Hi, this is Dr. Nick from the ECG Academy, and we're going to be talking about the sinus node in this section because sinus node dysfunction is a very common problem leading to slow heartbeats and symptoms, and we'll talk about a lot of the physiology here. Well, this is my cardiac conduction animation, and on the left-hand side, you've got some of the action potentials that you'll see in different tissues within the heart. Remember, every cardiac muscle cell is able to generate a little tiny electrical signal because of movement of sodium into the cell, which makes the inside of the cell more positive, and then potassium usually rushing out of the cell in order to restore the normal resting membrane potential. Well, we'll get into the advanced physiology in one of the talks in the advanced level, but for now, let's just talk about the sinus node. Okay, so here's the sinus node in the top of the right atrium. It fires on a regular basis and it sends out electrical signals that generate the atrial depolarization. Those are the P waves. Now, the sinus nodal cells have a pretty unique looking action potential that has a relatively slow upstroke. And in between action potentials, you have what's known as a phase 4 diastolic depolarization. And as I said, I'll get more into that in the physiology talks. But for now, let's just call this slow depolarization in between beats, otherwise known as diastolic depolarization. There are actually ion currents known as pacemaker currents, and these allow the cell to reach the threshold potential, which in this case is minus 50 millivolts. So as soon as that cell crosses that threshold potential, the movement of ions into the cell occurs, giving rise to this action potential. And as that action potential is conducted to the neighboring atrial muscle cells, that's what generates the P wave, which is the atrial depolarization. As you see, this is drawn with little tiny extensions, these little fibers that kind of connect the sinus node with the neighboring atrial myocardium. So this is important because certain types of sinus node dysfunction are actually due to failure of the conduction of that electrical signal out into the atrial myocardium. We'll talk about that later in this section. Most sinus node dysfunction, however, occurs because the rate of firing of this structure within the heart is inadequate to meet the body's needs. In other words, the heart rate isn't fast enough to push enough blood to meet the oxygen needs of all your organs, and so you start to have symptoms. What are the symptoms of sinus node dysfunction? Well, the symptoms include things like fatigue, lightheadedness, shortness of breath, difficulty exercising, and all those are signs and symptoms of an inadequate blood flow. But for the sake of our discussion of sinus node dysfunction, we're going to talk about electrocardiographic diagnoses. And this is a list of the kind of diagnoses you can make on a cardiogram. Sinus bradycardia we talked about a little bit in our initial talk of the sinus rhythm. Chronotropic incompetence refers to the fact that when a normal person exercises, his heart rate should go up. What's the normal heart rate in most people is about 60 to 80 beats per minute at rest. And so this is sort of the normal heart rate. If you're going to call normal sinus rhythm, remember that includes 60 to 100 beats per minute. But for the sake of this discussion, think of 60 to 80 beats per minute as a normal resting heart rate. But when people go to exercise, what happens? Their sinus node should speed up to increase their heart rate and allow someone to run up a flight of stairs or do some heavy work. When the sinus node is incapable of speeding up appropriately, we refer to that as a very specific clinical diagnosis known as chronotropic incompetence. Chrono meaning time. And so what that sort of refers to is the fact that the sinus rate does not speed up appropriately. Like if you had energy level, this is like exercise on a treadmill, and this is heart rate. You would expect that when the exercise begins, the heart rate should go up. And then when you rest, the heart rate sort of gradually goes back to normal again. Well, in people with chronotropic incompetence, what happens is their resting heart rate may be normal, but they can never really get their heart rate where it should go. And they get exercise intolerance, they get fatigue, they get out of breath with any kind of exertion. So that's one form of sinus node dysfunction, chronotropic incompetence. We're going to talk about sinus pauses, sinus arrest, and even post-tachycardia pauses. in the second chapter of this section, and the third chapter is going to be on a diagnosis that you can make known as SA exit block. To start with, let's look at a typical example of a patient with sinus node dysfunction. So here's the electrocardiogram, and if you look at the whole thing, scan it across, you can see that it's fairly regular. If you look for a QRS complex that lands on a heavy line, you see the first one does. So we can count off 300, 150, 100, 75, 60, 50. It's a little less than 50 beats per minute, like 48 perhaps. The next step, of course, is looking at the P waves themselves. Here's a P wave, and it's up in 1, it's up in AVF, and so the quadrant is appropriate. The axis is down in the lower left-hand quadrant, which goes along with the tall P wave in lead 2. So we know this is a sinus rhythm, and it's below 60 beats per minute, so we call it sinus bradycardia. Now, the PR interval looks at the upper limits of normal. I would have to call it about 180 to 200 milliseconds if you take calipers. Now, there is a little bit of noise in this EKG, but, this course is designed to help you look past that noise and read real cardiograms, not just the ones drawn in a textbook. If you look at the precordial leads, you can see easily that the PR interval is clearly in the normal range, here about 180 milliseconds. But the other interesting thing is that you can see an ST segment and a T wave, but this large bump right there, and in fact you can see it nicely in V4, is a wave that follows the T wave, and it's known as a U wave. The U, of course, comes after T in the alphabet. It's an interesting finding that this patient has visible U waves, although they're not so prominent that you would consider them abnormal. So this is just a typical example of sinus node dysfunction taking the form of sinus bradycardia. Now, if this was a 40-year-old long-distance runner, a rate of 48 beats per minute would not necessarily be abnormal. So you have to take the clinical circumstances into account if you're treating the patient. But as far as making an electrocardiographic diagnosis, this would be abnormal. It's sinus bradycardia. Let's look at the next one. Here we have another example of sinus bradycardia, but I picked this one in particular because when you scan across the cardiogram, you should notice that the heart rate suddenly slows down over here in the second half. So the heart rate's a bit faster on the left-hand side than it is in the right-hand side. All the P waves look alike, however, and the P being up in 1 in AVF tells you that this is a sinus rhythm, and there's a gradual change in heart rate, so we know that this is called sinus arrhythmia, but it's pretty remarkable how you have a heart rate here of 300, 150, 175, 60, just under 60, maybe 58 beats per minute, but then over here it slows down dramatically to a rate that's actually below 50 beats per minute, 300, 150, 175, 60, 50. It's about 46 beats per minute. If you felt like counting up milliseconds and dividing into 60,000, I get 1,360 milliseconds. If you divide that into 60,000, and you get 44 beats per minute. So that's a little bit more precise. So you have this sinus arrhythmia going on, but overall the heart rate is indeed less than 60, so we would call this sinus bradycardia as well. Now, sinus bradycardia can get to be pretty severe. Actually, here's an example from a Holter monitor in a patient who was being monitored because of lightheadedness. He was kneeling down in his garden, and he became very lightheaded, almost passed out. And you can see here a fairly steady rate, but when it's this slow, you kind of sort of have to count up milliseconds. So you got 1, 2, 3, 4, 5 is 1 second, 2, 4, 6, 7. So it's about 1,750 milliseconds, which if you plug into your calculator comes out to about 34 beats per minute. Very slow indeed. It's no wonder that this person got lightheaded because their brain just isn't getting enough oxygen given the fact that their heart is going so slowly. Now, in people who have symptoms from sinus node dysfunction, there's a specific clinical diagnosis called sick sinus syndrome. Sick sinus syndrome is one of the more common reasons for a permanent pacemaker to be implanted. Permanent pacemakers are electrical gadgets that are inserted under the skin and stimulate the heart to beat faster. And that's really the best way to treat sick sinus syndrome, assuming that the patient's not on some kind of medication that's making their heart slow. So sick sinus syndrome results in permanent pacemaker implant, and of course that will correct the slow heartbeat and thereby improve their symptoms. The last example I want to give is this from a telemetry unit. You guys and gals may see this if you're working in the CCU or on a cardiac unit. This is someone who clearly has sinus node dysfunction. The heart rate, even when it's going fast over here, is very slow. 300, 150, 100, 75, 60, 50, and then two more boxes is 40. So it's about 36 or 38 beats per minute here. You can see down here it slows down to about 20 beats per minute. Well, how did I get that? Well, let's count out the number of seconds in between beats and divide it into 60. Okay, so we start here, we'll count off 1, 2, 3, 4, that's 1 second. 1, 2, 3, 4, that's 2 seconds. 1, 2, 3, 4. So that's about 3 seconds in between beats. And 3 into 60 equals 20 beats per minute. So that's dreadfully slow, and this is a person who would likely have severe symptoms and would need to even have a temporary pacemaker inserted, provided that there wasn't a medication that could be immediately discontinued. So these are some examples of sinus bradycardia that you see in someone with sick sinus syndrome, otherwise known as sinus node dysfunction. And in the next video, I'm going to talk about sinus pauses, sinus arrest, and other examples of sudden failure of the sinus node to fire. For the ECG Academy, this is Dr. Nick. Thanks for watching.